I'm going to invite our panelists up to the stage as well. Thank you so much, Jim. And as our panelists are coming up, I'd like to just introduce this panel. I think in this panel, we're really going to be bringing the community and community health to the stage. And I want to start also by saying a thank you from the Community Health Center perspective. And there's so many of us here from the CHC world who have benefited enormously from this program, the Kraft Center. And I think I speak for all of us really in expressing gratitude for this program. I feel like I'm sure others feel the same way, that this program has meant really a breath of fresh air. It has infused investment and support and energy and space and time to really allow our most promising leaders to accomplish projects that I think otherwise would limp along, if even that. And the ripple effect in our health center of the work of Maggie Beiser and Jen Brody and Dave Munson has been enormous. In fact, these projects are integral to our mission and have, in fact, become a very significant part of our strategic planning. So I want to say thank you. Moving on to this panel. This panel really has a theme of empowerment and partnership, and the success of so many Kraft Center projects, as you've heard about and as you'll see around the room a little later. It's really rested on the ability of practitioners and fellows to forge strong partnerships with community members, and in some cases, closer relationships between Kraft Center clinicians and their patients have emerged over the course of project implementation. Patient perceptions have gone on to impact the Kraft Center project experience for the better in ways that really no one could have foreseen. So this panel discussion will explore the central role that clinician, community member partnerships have played in the Kraft Center projects. And in particular, I really hope that we'll highlight the ways in which some patients or community members have been empowered far beyond the initially hoped for improved health outcomes. And also the increased motivation and understanding of patient experiences that Kraft Center clinicians have themselves gained as a result of these deeper relationships. And not just working for, but with patients and community members to build health equity. I'm going to briefly introduce the three clinicians here and ask each of them to introduce the community member that they've been working with. First, Dr. Talia Salant is an internal medicine and primary care physician whose clinical experience while completing the Kraft Fellowship in Community Health Leadership was at the Bowdoin Street Health Center. And I'll ask Talia to introduce Riza Pereira.
Sure. So can you all hear me okay? I've introduced Riza several times. Riza is my community health worker at Bowdoin Street Health Center. She was born in Cape Verde, grew up there and in Portugal, came here as a teenager, and has worn many hats, including currently as a community health worker, but she's served as an interpreter. She's received her MBA, and she's been recognized for her work as a community health worker by the YMCA as a Black Achiever. She's also worked as a medical assistant at Bowdoin Street prior to serving her role as a community health worker. I'm very proud of her and happy that she's joined me.
Thank you. Dr. Nicholas Urbanchik is a Kraft Center practitioner who practices family medicine at Len Community Health Center. And I'll ask Dr. Urbanchik to introduce Marilyn Cox.
Thank you, Jessie. First, I have to admit something to the audience. I don't know how to tie a bow tie. So if it falls off during the middle of this, just don't get worried. Okay? I have a tie if I need it. But anyway, yeah, let me introduce Marilyn Cox. Great to be here with everyone today. Marilyn has been a patient of mine for almost 2 years, I would say now. It's been about 2 years at the Lynn Health Center. And she has been co-facilitating group visits with me for about that time. Marilyn comes from Arkansas, where she grew up, and moved to Lynn in about 2002 for work. And she is trained actually as a certified nurse assistant, which I think really speaks to how she has been really kind of doing really well with the group visits. And she kind of uses that background in her healthcare experience to really engage patients in the group visit and kind of become a leader of the group visit. So it's been great to partner with Marilyn in this. And I'll just say one other thing about Marilyn. Marilyn usually has some word of advice for me, typically during the day of the group visit, which is, Dr. Yu, just shut up. So nobody can say my last name. There's like several consonants at the end of it. It's Polish, so it's a big problem. But yeah, Dr. Yu is good. So no, but Marilyn usually what she has to say is just that it's important for patients and providers to work together. So really great. Thank you.
Great. And Dr. Genevieve Daftery is a pediatrician whose clinical experience while completing the Kraft Fellowship has been at the Codman Community Health Center, and she'll introduce Withelson Gay.
It's my great pleasure to introduce Withelson. He is a soon-to-be freshman at Boston College. A recent graduate of Codman Academy, which is a public charter school that is co-located very uniquely in our health center, and has been the site of the work that I've been doing. And Withelson has been a leader in the Nutrition Action Club, which is one of the student groups that's been really instrumental to helping do some of the project work that I did there. And he really is not just a leader in that group, but a leader across the school. And I think as we've learned a lot about leadership through this fellowship, he actually already has many of the natural talents that many of us are trying to work into our strategies. He's extremely humble, very thoughtful, and willing to innovate and advocate. And he knows exactly when, in a conversation within club, to push us to the next level, which I have really appreciated. And I'm sure is going to serve you very well as you go off to college. He also completed a very rigorous program as a Crimson Scholar through Harvard University, chosen because of his amazing promise early in high school to get him even more prepared for Boston College, who's going to be lucky to have him in the fall. And I saw you telling people business and maybe pre-med, and I'm hoping I get to have a little hand in that.
Excellent, thank you. So I'm going to try my hand as Oprah Winfrey here. So instead of opening by asking you some of your deepest secrets, I'll open by asking the Kraft clinicians to first describe briefly your project. Maybe we could start with Talia.
Sure. So my poster is back there with more details, and I'm not going to embarrass myself in front of experts on community health workers, including Riza, on what a community health worker is, but it's a role that I've been increasingly interested in and begun to really believe that these are the unsung heroes of the healthcare workforce, both in the United States and around the world. And I wanted to do a project that involved community health workers, and when I came to Bowdoin Street Health Center, I realized there was really an opportunity to bring this role to the health center for a couple of reasons. The one is that Bowdoin Street has been participating in the patient-centered medical home transformation, which is this idea that there's multidisciplinary care organized around patients' needs. It's coordinated and integrated. But the one thing that was absent from the patient-centered medical home was the home and the patient's home and the environment where our patients struggle with managing their health and confront a lot of things that go beyond biology in determining their well-being. And so there was really this opportunity to demonstrate that a community health worker can be a valuable and complementary member of this multidisciplinary team. And the other piece of that is Bowdoin Street Health Center has within its mission this idea that we're serving not just the health of our patients, but the health of our community. And we have a vibrant community health department which works on violence prevention, healthy food access, a variety of community organizing interventions. But I think there's been a struggle to integrate that work into the day-to-day care of our patients. And so there was this opportunity again to have an individual who could help us bridge those different aspects of the health center. And so not having had a community health worker, part of my project was just figuring out how to bring on this role and how to educate team members and staff members on what the role was exactly. And I think we're still figuring that out. We started the role off in a pilot project focusing on high-risk diabetics in our patient-centered medical home, and providing an intervention that involved home visiting and a variety of navigation and accompaniment skills and services to improving the health of these sort of chronically non-adherent and uncontrolled diabetics. And over about 8 or 9 months of the intervention, we were able to see dramatic improvements in clinical markers of diabetes control, hemoglobin A1Cs, but also improvements in high-cost utilizations. And that work is ongoing. Riza has gotten involved in caring for patients across the health center for a variety of needs. She's worked with over 80 patients, almost 200 extended interactions. I mean, she's been super busy and really has kind of given us a sense of the possibility of this work as we're moving forward and trying to figure out how to expand the role at the health center.
Mm-hmm. And Riza, maybe we could ask you at this point, having been super busy recently, to describe a little bit about what your work is like. And I'm really curious to know what you perceive as being different in your role, what you bring to the health center really that's different from other people who are involved.
Hi, everybody. The knowledge of the healthcare system, knowing the community, the language, the culture. And by being certified as a community health worker, I got a lot of training in how to deal with patients that's going through a lot on a daily basis, like housing, DTA, basically everything.
And Riza, do you mind also just sort of clarifying to sort of how the work that you're doing now as a community health worker is different from that of, say, a medical assistant?
I'm kind of a facilitator, like a provider, quote unquote. They come to me with opening letters, reading to them, because a lot of my patients are illiterate. Going to them to Social Security office, applying for housing, food stamps, helping them understand the healthcare system better, and trust, because a lot of them do trust me because of the culture and the language, and I kind of facilitate between the doctors and
so a lot of the work that you do, it sounds like, happens even outside of the context of, or the walls, the formal walls of the health center.
And a lot of the home visits, I learn a lot of things there that the doctors didn't know about it before.
Okay, thank you for that. Nick, if we turn to you just to ask you to describe your project with group visits.
Yeah, so maybe I'll just ask the audience, do people know what group visits are? Has anybody heard of the term? I see a lot of shaking heads and hand. People know in the Kraft Center, yeah. But yeah, so instead of, when you go to see your medical provider, typically you would be a patient seeing that medical provider in a one-on-one session. So we've thought about how that works at the Lynn Health Center and thinking about the patient care experience a lot and how we can improve that. And one tool for that, and it's not a new tool, it's been around. I know John Goodson here at Harvard, I think, does some group visits. There's a lot of people doing group visits. To think about the patient care experience and having patients come instead to one patient to see one provider one time. There's a group of patients, and the group of patients that I'm working with right now is diabetes. And those patients see a kind of team of medical providers. So that would be me. Typically, I'm usually there. And then there are the patients and usually a clinical assistant or a nurse kind of in a role of a facilitator. So I'm there for the medical piece, medical management. It's an appointment like any other medical appointment, including medication management, medication education, disease education. And then there is the real piece that I think is missing from just routine one-on-one visits. Well, 15 minutes is time, so we don't have a lot of time to see patients. 15 minutes is not a lot of time, and so we can expand that time for 1 hour and see perhaps a few more patients, but have more time with a group of patients in a setting. And I think the patients tend to appreciate it. I mean, we've been doing some satisfaction surveys, looking at trust and physician scales as a way to see how the patients feel about the group. And from what we can tell, it seems like really patients do feel empowered. That they feel that their provider is working with them in a group setting as a team to allow them to self-manage their diabetes, in this case as a chronic disease, for better outcomes. So.
Great, thank you. And Marilyn, tell us about how it is that you sort of emerged as a leader in this group, and what has it meant for you to participate in that way?
Well, I'm a diabetic patient myself, and I came there for treatment, and the group meeting helped me there. When I came there, I started out talking to some of the other patients there that were in the group, and some of them didn't understand the diabetes because a lot of them are Latino and they needed translation, and they didn't understand taking their medication, how important it was. And I was there one point, where I didn't want to take my medication because I didn't think it would help me. And so I said, well, maybe if I let them know that I'm doing good, then it would help them. So I started by showing them that it helped me. So I guess that kind of made me become a leader in the group by showing them that it helped me. So that's how it came about.
And then that sort of your explanation kind of leads me to ask about, what is it about your interaction with other patients in this group that has been different and empowering in some way that, no offense, Nick, but that the doctor maybe hasn't been able to do? What's been different about your involvement?
Well, that's reaching the patients, because sometimes the patients don't listen to the doctors, but they do listen. They do listen to another patient that's going through some of the same things that you're going through, because they can relate to your symptoms if they're having the same kind of pain that you're having, and the doctor's trying to explain, well, this is what you're going through, and they're like, okay, I don't want to hear that. But if another patient is explaining, I'm having that same symptom, then they can understand it a little more. And that's kind of what's happening with me, So I kind of let me tell you a story about this one lady that's in the group. She, her AC1 level is up high, and she says, oh, I don't want to take the medicine. It doesn't work. It don't work. It don't work, And so I said, no, you have to keep taking it. It's going to work. It's going to work. She said, oh, no, it don't work. It don't work. So guess what? Her AC level is down now, So it proves that it's working, And then she has a problem with her weight. I have a problem with my weight. So I'm working on my weight. And so I told her, maybe, Dr. Bencher can help you out with that, And so she says, oh, no.
She read
So
it, Marilyn.
I told Dr. Urbanchik, I said, I'll make a promise with you. I said, I'm trying to get to a size 16. And so he says, oh, I said, I have a size 16 skirt at home. And I get this size 16 skirt on, I'm going to show you. And I put that skirt on, and I showed him that I could wear that size 16 skirt, right? So I wore it to the meeting, and she said, oh, Mommy, I want it. And so now she wants the medicine that I take to lose the weight.
What a partnership, you two.
So,
okay. That sounds like a show we need to take on the road. Genevieve, maybe you could describe your project for us?
So in many ways, I think my project sometimes didn't feel like a project as much as a relationship building experience. So the Health Center and Codman Academy, the public charter school that Whithelson attends, have been co-located for a little over a dozen years now. And when I came on, one of the questions was, how can we actually integrate better and think about ways that we might be caring for students in a way that is not necessarily patient related. So not all the students at the health center are patients, of the students are patients at the health center. And the approach was to get a sense of what folks at the health center and the school knew about each other and felt like they did well together already, and things that they wanted to focus on. And one of the things that emerged on both sides was an emphasis on pediatric obesity rates and nutrition. The school already had a really rigorous nutrition policy and food program. And then also what actually emerged was some sense of needing to focus a little bit more on resilience, that within the rigors of the school day and the emphasis on wellness through nutrition and emphasis on obesity, that perhaps some of the kind of broader behavioral health and mental health things and resilience were percolating and not being addressed. And so it was a nice opportunity for me to think about using things that I think are really important, which are youth empowerment tools, quality improvement tools, and qualitative methods of focus groups. And we actually engaged the Nutrition Action Club that Whithelson is a part of last year in breaking down their school's BMI measurement process. So that had sort of come up as a thorn in the side of sorts of a lot of the students feeling like it, all sorts of things. I mean, you can imagine, nobody likes their BMI being measured even in clinic, and having it measured in school is fraught with a lot of different complications and pushback. And so we got to hear all of those things out and then actually engage the students in the Nutrition Action Club in redesigning the entire BMI measurement process for the school. And last year, what they told us kind of briefly was that they wanted some privacy. They wanted it to feel more like it was being done in a medical context, and that school was kind of judging that particular part of their well-being. And they wanted more follow-up. Like, they didn't just want to be given a number and shown the door. They wanted to actually have a discussion, and so that is what we did with them. And so the BMI measurement process now involves students coming into the health center being measured individually, privately by myself or one of the other medical staff in the health center, the school nurse who actually is a health center employee as well. They get an individual motivation interviewing-like conversation with us, and now they're actually setting goals, much in the same way we would set patient goals during a visit. And this was their idea, and I thought it was so wonderful that it actually dovetailed so nicely with what it's taken us through a lot of time in medicine to realize our patients want. The students said it really clearly, and so they now have that new process. And this year we kind of tweaked the process a little bit, and then with the help of Whithelson and a lot of the students in his group have kind of taken a next step of thinking about how we can do some more rigorous evaluation of the nutrition program and the food program at the school. And a group of them were involved in a focus group training so that they can now actually facilitate some of these groups that we're going to use to evaluate nutrition across the school.
That sounds incredible. Whithelson, can you tell us a bit about how you got interested, first of all, in the Nutrition Action Club?
To be honest, I was kind of thrown into the Nutrition Action Club. I don't know, I was confused because it was Wednesday and club came, and they kind of redirected me towards the Nutrition Action Club room, and I was like, wait, I don't belong here. And I don't know, it was kind of forced, and I don't know, through like by the end of the first session, I came to kind of accept it. I stopped fighting it. I was like, if I'm gonna be forced to be in here, I might as well contribute to it. And as the sessions continued, that's when I really found that I really was interested in the Nutrition Action Club. I wanted to know a little bit more about nutrition, how to be healthy. I've always wanted to kind of like learn about my own personal health, and being part of the club kind of helped with that. It really gave me a sense of how to eat right, what proper nutrition really is, and I don't know, I was thankful that I was kind of thrown into the program by the time it ended.
So you just sort of happened to be in the right or wrong place at the right or wrong time. And then I'm wondering how the heck you stayed, even though your doctor is participating in this school student club. What has it been like to have your doctor participating in this club at school?
Okay, so when she first came in, I was like, what is she doing here? I think that the director of the group kind of sent out a message, but I must have missed it. And when I saw her, I'm like, is this a one-time thing?
Walked in, and there she was.
Yeah, I walked in, and then she walked in through the door, and I'm like, I'm
Should I
hoping
run?
this is a one-time thing. I really was. Because, I don't know, at first, it's not that I didn't feel uncomfortable, but it's just she gets to see me outside of the doctor room. And she got to see a little bit more of me than I would have, kind of liked her to. But
I hear you.
I don't know. And again, after the first session, I thought she'd be focused more on me than the Nutrition Action Club. But that wasn't the case. She just kind of blended in. Everything went smoothly, and I was like, this might work. And after the next couple of sessions, she came in, and as we were doing some work on nutrition, and primarily we were focusing on getting, trying to take some steps out of taking McDonald's, which is right in the square, right next to our school, out of the area. And she brought some great ideas forward. And I don't know, ever since then, it's kind of been a wonderful experience to have with her.
Great. I'm going to hear more about that in a minute. I want to turn again to Nick and Talia and Genevieve and ask a little bit about, actually, rather than talking about the challenges, and I'm sure there were plenty of challenges along the way in doing this work. I mean, the 3 projects that you've described are really innovative in the places where you're working. But I wonder if you could instead, in just a brief time, talk about what you're most proud of in the work of your craft work. And maybe we could start with Nick, just to change up the order.
Yeah. So what I'm most proud of with diabetes group visits at Lynn would be, I just think about the title of this panel, and the panel is titled Partnership and Empowerment. So I think that through the group visits, we've empowered patients to self-manage their diabetes better. And when Paul Farmer is talking about empowering community people to manage their care themselves, I think that's what we're trying to do. So I'm really proud of Maryland for that, emerging as a leader of the group visits, having patients facilitate their own group visit with an agenda and a activating patients to manage their care. So I think I'm most proud of that. I'm also very proud of our staff at the Lynn Health Center, which includes our nurses and our clinical assistants. Some of our clinical assistants are taking on these newer roles. They're not just, putting patients in the exam room, but they're actually, being part of the group visit process, facilitating group visits, learning about diabetes, and then being empowered now to go on to nursing school because of what they learned from the group visit. So again, just empowerment at all levels, basically. I'm very proud of that.
Great. Genevieve, how about you? What are you most proud of?
So I think there's 2 things. One, I think that probably in many ways Withelson doesn't even think of me of having done a project. I think that, the fact that it was really me going to them and then letting them lead the way, and that the students really kind of took control of something and changed it, and I was kind of there to help support that, but I didn't actually need to lead much in that, was really amazing. So I'm proud of them for actually owning and doing all of that work. And then I'm also proud of this sort of frame shift that has happened over the last 2 years at the school and somewhat within the health center too, around thinking about what our relationship is going to be and what's important. So, I think the school and some general outside context too has started to think, measuring everyone's BMIs and being only focused on obesity might not be what is wellness, and have been really open to taking that thread that they had in our conversations about resilience and expounding on it a bit. And as a result, we're not just considering the BMI as the health screening for the year, but we're actually using some behavioral health screening tools. And I think there's an openness to potentially, kind of change their whole concept of what we're going to do together, to not just include us coming to them with medical care. And I think that was sort of the ask at the beginning of the conversation. And I think through really listening to them and then feeding back what they were telling us and doing this work together, we've actually moved to this entirely new place of thinking about approaching this in a much more community-based, youth-focused way that's much broader.
I'm very proud of Riza. That's one of the things I'm very proud of. I think, she took a huge risk in taking on this new role, and she really rose to the challenge and has been recognized for it and awarded for it. And I think it's just a remarkable achievement. I think the other thing that I'm proud of has more to do with sort of showing the value of her work. I've believed in the value of her work, but it's a lot harder to have other people appreciate that. And one of the things I think the Kraft support allowed me to do was to take the time to design a rigorous project that could show the quantitative value of the work, but also have other folks at the health center really experience that value. And what we're seeing now is kind of a challenge, is that there's so much need for her services. Many people are sort of latching on to this idea that she provides this unique, valuable service. And so we're kind of navigating, setting boundaries and saying no. But I think that's a good problem to be having. I think the other way that others have recognized the value of her work, but also of the work kind of that the Kraft Center does, is, leaders at my health center are starting to appreciate the value of having folks who can take a step back and think about the work that we're doing broadly and try to figure out, is it the best way to be doing this work? Are there other ways we could be doing it better? How do we study it? How do we evaluate it? And so there's sort of value on a number of levels that not just I've appreciated, but I think others have appreciated, with sort of having this opportunity to sort of split my time and be credible within the health center as a provider, and then have others be able to take that next step and appreciate the value as well.
Thank you. I have one question left for each of Riza and Marilyn and Withelson. And Riza, I wondered if you could talk about what you see as the impact of your work at the health center now. What's the impact?
I could use a two-letter example about, like Dr. Solan said, I'm working with a lot of patients, but I have two examples of patients that I'm closely working with right now. A 68-year-old male, uncontrolled diabetes, sharing an apartment with his girlfriend, who is verbally abusive to him. She doesn't allow VNA or anyone in the house to take care of him, but we got a trusting relationship that she allows me to go in the house. He secretly asked me to kind of help him find an apartment to move because he can't take it anymore. But it's a work in progress, so we're working on that. Another one is a 57-year-old female who has uncontrolled HIV and undiagnosed psychiatric disease. She doesn't trust the healthcare system very much, so we created this relationship where she wants me to do everything for her, like accompanying her to infectious diseases appointments where she used to miss a lot in the past, going with her to Social Security and everything else. So I'm a big impact on her health.
Yeah, I hear that. I hear when you tell those stories that, these are sort of dynamics that you're navigating that I don't think the healthcare team would necessarily even know about were it not for you there. Just really good illustrations of how much impact you're having on the health of those individuals. Marilyn, I wondered if you could talk a little bit about the impact of the group. I have a great sense from you about how you've influenced other people in the group in a really positive way. And I just wonder sort of what it's meant to you personally to be participating in the way that you have.
But it helped me become my own self-experience. It empowered my own self-experience and made me become a better leader for myself as well as a leader for the group. And I hope I can become a better leader for everyone else in the group. That's my my goal right now, and continue to improve my health and the diabetes and the weight loss, and just live a better life.
Thank you. It's an incredible impact you're having on this community.
And the community, the Lynn Community Health Center, the impact that I have on them is I'm getting kind of tongue twisted right now. Y'all have to excuse me.
I would venture to say, Marilyn, that that the way that you're helping people sort of change their mindsets around diabetes in this group, and the way that you've sort of inserted yourself into this group has made it such really that this group is a lot more impactful. I'm imagining that the ways that that you are interacting with folks in that group are just incredibly valuable and so different from the ways that a clinician typically would, and that's probably had the greatest impact on the.
I would say that, yes. I would say that because I see how it has. I see when people come to the group how they have improved in their health and everything like that, and that makes me feel real good seeing that the different changes in their health, and that makes me feel good, even though I'm not a doctor, but
sort of a positive feedback loop.
Yes, the feedback from them that makes me feel good. So
thank you.
I guess
Withelson, you mentioned for a minute that the work of this club has begun to take on McDonald's. My goodness. And so I was wondering about sort of what you've learned about having a voice and about being an advocate as a high school student participating in this club.
I've always been kind of like a silent leader, always doing rather than saying. But the group, while being in the group, I felt that I had to speak a little bit more because everyone was a bit tentative. They didn't want to speak. They didn't want to get their ideas out there. And as I began to share mine, it kind of got them to be a little outspoken and also share theirs. And in terms of like leaders, I don't really see myself as a leader. I think that all of us can be leaders, and all the people in my group have shown that to be true. It's kind of like amazing because at first I had no idea that they wanted to kind of like take on McDonald's or anything like that. We kind of debated about that. It was a long debate. There was screaming here and there from one particular group member.
It's hard to let go of those French fries.
And yeah, we knew that it was going to be a hard task, and we knew that it wouldn't just be one step. We had multiple things that we needed to take care of, and our carbon tour kind of correlated with the things that we were doing in Nutrition Action Club, which is kind of showing the positive aspects of our community rather than the deficits. And we felt that the McDonald's right in the square was a major deficit to the students more than anybody else, because we see obesity everywhere. There are people within the group that felt that they were unhealthy, and they felt if something could be done about McDonald's, it would bring significant changes in the school atmosphere and around the community overall. And it was just great being a part of it.
It's incredible. Thank you. So before I turn to just sort of summarize a couple of themes that have emerged, I wondered if we could take a minute to ask questions from the audience of anyone on the panel. Maybe one or two questions. Anything burning? Yes. Thank you for that. Any other last comments or questions from the audience? Yes, Shunda in the back row.
I have a question about the group visits. I'm curious, how were you able to, and thank you for everyone who, thank you, I would never be able to be there. But how are you able to create a sense of cohesion in folks that didn't know each other, and to have them talk about things that may be private, their medical problems, their things in their house, what they do that they may be ashamed of. I'm curious, how are you able to do that?
Yeah, that's a great question. I'm not sure if that's for Marilyn and me, both of us, but I'll start off and just say that, so you got some people in the group who are very quiet. I mean, I'm probably more of a quiet person, I would guess, but some people overshare. You got the oversharers in the group, so you got to be very delicate like Marilyn is and kind of coordinate a group of people, which can be difficult, right? I mean, we think about our own lives, and if you're professors or teachers or you're trying to give a lecture, I mean, or even coordinate a group is very difficult.
You have to gain trust.
Yes.
You have to gain their trust, and once they see that you're on the same level as them, they open up, Like I'm out there in Lynn, and most of the patients are Latino. They don't speak English, and they relate to me, and I relate to them, So it's about trust, And once you gain the trust, it's open season.
It's a great, Marilyn, you've just summarized my take-home points. So thank you.
Sorry.
That's perfect. In closing, I mean, I think it strikes you as it does me in listening to this group. Just that this type of partnership is really what is so powerful in community health, and that the greatest opportunities and value come with this kind of partnering and empowering with community members to improve health. That clinicians are not the experts. It's our patients who are the experts. I think another kind of take-home point that I hope you hear from this and other presentations is just the ripple effect of these projects on individual patient lives, on the experience of the clinicians who have learned, in this case, so much from their community members that they probably didn't know before partnering in this way, but also within each of the community health centers and in our community more broadly. The chance to sort of step out of the daily grind, to redesign a care model, to involve in a very intimate way community members and partners in that redesign is what has been the most powerful here. And this work, finally, really doesn't happen without resource and time and support. And for that, we really have the Kraft Center to thank. So thank you all very much.